In the news this week, petrol vouchers to fight the rising cost of living. Calls for Premier Mark McGowan to consider additional help for struggling families. An exclusive interview coming up.
Concerns over the strength of WA's emergency laws raised as the state government plans to keep G2G data for 25 years. Nurses and midwives take mass industrial action in pursuit of a 10% pay rise. And later, Dr. Andrew Miller's comment.
This is The Evening News with Ivan Loom and Maliva Thorne.
Good evening. Calls for reprieve from the rising cost of living have intensified, with a major community leader urging Premier Mark McGowan to provide petrol vouchers for struggling WA families. This coincides with the mini-budget set to be delivered by the Albanese government in less than 2 weeks. Multicultural Services Centre WA Executive Director Ramdas Sankaran joins us exclusively on why he backs the policy idea. Ramdas, thanks for your time. Do you believe Premier and Treasurer Mark McGowan should roll out fuel vouchers to assist low-income families in WA?
Yeah, as I said, Ivan, I think it's important that there is relief provided, whether it's actually as a fuel voucher or it's in some other form, because you need to place, adequate safeguards to ensure that, fuel vouchers are used for the purpose of purchasing fuel and not for anything else. So I think it's worth, contemplating, considering, how best the relief can be made.
If the policy idea does go ahead, how should it be targeted? How do we define struggling families, and how much fuel vouchers should they get?
Look, in terms of what families, I think the best benchmark you would use for these kinds of incentives would be anyone on receiving any kind of Centrelink benefit. Centrelink benefit now goes not just to people who are unemployed and who may be in receipt of an aged or disability pension, but also for people who receive parenting allowance. So it does cover a wide range of people on low incomes. So I would say that's probably a good place to start, because that would cover a range of families who are both receiving the general Centrelink benefits, but also what you would call on low incomes and getting some assistance.
Is it time for the McGowan government to strongly consider fuel vouchers and a suite of new relief measures across the board, given they're sitting on a $6 billion surplus?
Look, the McGowan government, as far as I'm concerned, has got no excuses not just to provide relief in terms of fuel, but in most other areas such as housing, such as health, such as education, across the board. At the end of the day, we pride ourselves as being a civilized society, a society that values multiculturalism and cultural diversity, a society that emphasizes social cohesion, inclusivity, and what have you. And yet, when you start looking at how we deal with all of these issues, on the one hand, and take the incredible positive territory that our budget has been and will continue to be, it just doesn't add up.
The discussion of WA's powerful emergency laws continued this week, with growing concerns over the reach of the temporary declaration. The opposition also highlighted the McGowan government's move to keep G2G data for 25 years. Health Minister Amber Jade Sanderson responded by saying it's imperative to keep the step-down provisions.
The state of emergency laws has been wound down recently as Western Australia learns to live with the pandemic. Currently, the transition into a temporary COVID declaration will allow the McGowan government to manage the virus in the medium term, with permissions on implementing isolation rules, masks and other measures except for state border closures. Although the legislation will expire 2 years later, concerns over the power of the legislation becomes the focus, as it gives police officers broad powers after the police commissioner seeks advice from the chief health officer.
There's one little phrase there that says a police officer can direct any person to do anything that the officer considers reasonable. Boy, they're pretty big powers that the police commissioner, as the state emergency coordinator, will have utter and total power to impose whatever restrictions he sees fit. And there's no review There's no judicial review. And I think really the most important thing is it completely bypasses Parliament.
Apart from that, the McGowan government also plans to keep G2G data for 25 years. The opposition believes there needs to be an explanation as to why it needs to be kept for so long.
This is a really personal data. There can be no practical reason for the police to want to keep this or for the government to want to keep it. And the excuses that Minister Papali'i has given for it are frankly weak.
WA Health Minister Amber-Jade Sanderson responded to the matter, stating it's imperative to keep the step-down provisions on virus management. She again stressed that Western Australia is not out of the woods when it comes to the pandemic.
Well, look, this is an appropriate model for the circumstances that we find ourselves in. They are much more limited, the powers, than a broader state of emergency, and they are related directly to managing COVID. And we have seen the Police Commissioner and certainly the Chief Health Officer working very constructively with each other and with the government in managing these directions and mandates where required. This is an appropriate response to where we find ourselves now, which is a lower alert, but an alert where we may still need those policies and those levers to manage infection in the community.
The eastern states are currently facing major floods, with Victoria joining New South Wales and Tasmania in their battle against the rising waters. When Melbourne resident Kit Sanders woke up on Friday morning, she was greeted by the sight of muddy waters flooding her street. The floods occurred after the Maribyrnong River burst its banks this week, turning streets into rivers and sweeping away parked vehicles, with SES volunteers rescuing residents in the area.
I'm standing by JJ Holland Park in the quiet Melbourne suburb of Kensington, where residents, including myself, woke up this morning to floods. Heavy rains overnight have inundated the drainage system and caused the banks of the Maribyrnong River to burst. Despite being 600 metres from the river, this street has flooded and several people have lost their cars to the floodwater, with one resident even pushing their car out of the water only for it to be overtaken again. High tide was at approximately 10 a.m. this morning, with water peaking at about midday. While there are hopes the flood is subsiding, more rain is expected to come this evening.
WA Police announced they have purchased 2 tactical response group vessels to secure the force's ability to respond to high-risk naval incidents such as counter-terrorism. The newly ordered rigid-hulled inflatable boat will substitute the current 15-year-old RHIBs, which are at the end of their operational life. Police Minister Paul Papali'i and Police Commissioner Cole Blanche made the announcement earlier this week, emphasising that the new RHIBs will play crucial roles in stopping the movement of illicit drugs. Authorities added that stopping the illicit trade can be a dangerous task, and RHIBs are vital in protecting TRG officers and the community. The $1.3 million investment in RHIB vessels will be delivered by WA local boat builder Kirby Marine, with both boats to be delivered to the TRG in 2023.
On the 20th anniversary of the horrific Bali bombings, Western Australians have come together to honour the victims and survivors. Out of the 202 people killed as a result of the bombings in Kuta on October 12, 2002, 88 were Australians. A memorial service was conducted at the Bali Memorial in Kings Park, held by the Bali Memorial Association with the help of the state government. A private breakfast was also held by the state government for WA citizens directly affected by the terrible event.
Now, the trauma that you carry, vicarious trauma you carry, doesn't leave you. But as I say, my copious strategy is trying to make sure that we learn something from every day so that we can reduce the suffering tomorrow. And that may be big, it may be small, and it's driven our research and innovation strategy for decades now.
Now to this week's virus update. The WA Health Department has reported 4,859 cases. There are 2,900 active cases, 152 people hospitalised and 3 in intensive care. The department has reported 6 deaths dating back to the 10th of September, with people aged between 69 to 93 years old. The total number of PCR tests this week was 7,653, and the total number of positive rapid antigen tests was 3,646. The Health Department has urged anyone experiencing symptoms to stay home until symptoms have resolved.
And now some housekeeping. WAMN News is glad to announce that Madeline Lombardi is joining the team. and her first appearance will be on this broadcast next Sunday, along with her weekday reports and feature writings on the WAMN Extra News Club. Maddie is thrilled to become part of the team and aims to celebrate diverse voices.
What makes me excited is because I have a background in auditory journalism, I'm really excited to start getting on the field, doing pieces for WAM News that are just written, also reporting style as well. The most important stories that I want to bring to the table, I definitely want to celebrate diverse news, so I want to really champion platforms for people from multicultural backgrounds, from First Nation backgrounds, people from different perspectives who have different voices and share their story onto the platform as well. So that's really something that I want to push and want to tell in my storytelling.
We're very excited to be working with Maddie, and we look forward to her debut starting next week.
She's a very talented individual, and she'll be taking on the Western Perspective segment along with other stories. We know she has a lot of interviews and story ideas, and we look forward to her contribution. For the meantime, though, here's Luke Derrick with Western Perspective. Good evening, Luke.
Thanks, Ivan and Melly. Welcome to Western Perspective. I'm Luke Derrick. Around 2,500 nurses and midwives walked off the job this week to attend an industrial action meeting held by the nursing union. Frustrated health workers have backed calls for a 10% pay rise, a $4,500 one-off payment, and better nurse-to-patient ratios.
When we look at the politics, we see that nursing and midwifery is treated as a cost. And in the cost efficiency model, it means that cost must be controlled. That means that we need to reduce the number of nurses or midwives. We need to replace them with cheaper workers. But that's old thinking. It's some 50 years old. What we need is a system that values your work, values what nurses do. Now, while I can't talk about the report, I want to say that the report reflects the views of nurses and midwives. I heard so many stories from the nurses who I interviewed, I met with. I heard these stories from my colleagues who are still working in the healthcare system. I heard them from my children's friends who are working in the healthcare system. We need to do something now. Western Australia is facing a shortage and an increasing shortage of nurses and midwives. I work in a global workforce committee looking at the world shortage. Other jurisdictions, other countries are doing something. We need to do it now, or there will be less of us to care for patients.
Following the rally, we spoke with ANF WA State Secretary Janet Ree about whether the push for a 10% wage rise and a $4,500 one-off cash payment is too radical.
Well, it is a radical increase, and we're going to put that to the Health Minister's office and see what their response is.
I don't think there will be a positive response at this point.
I'm not sure, to be honest. I was quite surprised that the nurses and midwives voted for such a high increase, but as I said, you know, it doesn't hurt to ask.
What does it imply?
Well, they're not happy, they're frightened, and they feel undervalued and taken advantage of by the current state of affairs that the government has with the hospital system.
Are you concerned that there are not enough graduates? In fact, it's dropping at the moment.
Unfortunately, the system has been flooded with graduates and junior nurses, which has put a tremendous strain on the more senior nurses and midwives to try and train and mentor them. We do need to have a steady influx of graduate nurses and midwives to keep the system going in the future. We can't have these sort of boom and bust cycles of nurses and midwives, so I think to keep that stream steady, they need to look at how that's being implemented.
What if the government says they can't afford 10%? What do you have to say to that?
Well, we can keep negotiating and see what they will agree to and see if our members agree with what the government offers.
Do you see this movement continue to escalate, or you're hoping that they will go back down to normal very soon?
I'm hopeful that this meeting today will be enough to make the government listen to our issues and to look at our log of claims more closely. But yeah, if it does escalate, then it does. The members have voted that they want it to escalate if the government continues to ignore us.
And now, here is AMA WA spokesman Dr. Andrew Miller with his weekly COVID-19 update and medical commentary.
Hi, thanks for your time. In COVID news this week coming out of Singapore, there's concern around what's being called the XBB variant of Omicron, which is now interestingly more different to SARS-2, the original Wuhan strain, than SARS-1 was. So some people are suggesting this is almost like a SARS-3. What does that mean in practical terms? Do we need to worry? Well, unfortunately, hospitalisations and deaths are on the increase in Singapore at the moment, as we see on Our World in data. And the spread of it in a highly vaccinated population, more than 90% of people vaccinated there, which is higher than it is here in Australia now. A lot of people haven't had their third dose, certainly even more than that, haven't had their fourth dose of vaccine here in Australia. So we're seeing what's called immune escape, which is what you would expect from these viruses as they mutate. The ones that are successful are the ones that are going to get around the existing immunity that's out there. So why are we getting the message from our government that everything's pretty much honky-dory and we should go back to living life as normal? They must be very worried watching these developments overseas at the moment, because they're now starting to think that we're going to have to reduce transmission somehow in the future. And the only thing I can speculate is they're letting people have a bit of a holiday without having to worry about it at the moment. And then just accepting that in time they're going to have to come back and say that we will need further restrictions, because our public hospital system certainly can't afford a big impost of patients, as we're starting to see in Singapore now and in places like Germany. And we know that we're short of healthcare workers, and I want to make a comment that I'm in full support of nurses trying to get a better deal out of the government at this stage. In a wealthy state like ours, we should be looking after them preciously, because we're definitely going to need nurses and doctors and everybody else in that system to be well looked after, to look after us for all of our usual problems, let alone potential further waves of COVID with things like the XBB variant coming up. So this is no big surprise. It's not something to be particularly scared and worried about, because we know the tools that we need to control the transmission of these viruses, being masks in crowded indoor places, being up to date with vaccination, hopefully getting some news on vaccinating under 5s in the near future from ATAGI. This might be another thing that gets them down the road to protecting those little kids, and making sure there's really good ventilation, fresh air in all spaces, because the one great thing about fresh air and about ventilating a space, doesn't matter what the virus does, that'll work against every variant of that disease and many other diseases besides. Thanks very much for your time.
And that's Western Perspective for this week. We'll be back again next time, but for now, it's back to you, Ivan and Melly.
Thanks, Luke. And now here's Leo with what's coming up on 6 News tonight.
Thanks, guys. Tonight on 6 News, a massive clean-up effort begins for some, others still under evacuation warnings and on high alert after rain lashes much of the eastern states. Also exclusive, Firefighters Union Secretary Peter Marshall speaks to 6 News about a new pre-election campaign blitz accusing the Andrews government of trashing firefighter cancer laws, and a report finds that Australia's social security system is keeping students in poverty, with the federal government called upon to change age of independence rules. You can see full details on those stories and plenty more by heading to our YouTube channel. Just search 6 News Australia to find us, or head to our website, 6newsau.com. For now, though, guys, it's back to you.
Thanks, Leo. And that's our weekly news and current affairs. With the latest news on our website, wamnnews.com.au.
Don't forget to subscribe to the WAMN Extra News Club so we can continue our work in the community. Full details on wamnnews.com.au/news/extra. From Melly and myself, we wish you good health, good night. See you next Sunday.
Thanks for watching.